My name is Asan Shabahang, and in this video, I wanted to tell you guys a little bit about me, my background, and my practice. As a mental health therapist, your well-being and your journey is my number one priority. I have a variety of education helping me and equipping me to support you throughout the way. In the beginning of my journey, I started my practice and I started my study with an associate degree in English literature. But as time went by, I fell in love and I got fascinated with the world of psychology. So that's what I did. I got my bachelor's degree in psychology. Alongside that, because my passion was also towards business, I got a minor in business. After finishing my bachelor's degree, I decided to make my focus into mental health and helping people achieving their goals. So I started looking out for programs and I found out the best way that I can practice this is by getting a degree in clinical mental health counseling. And I got my degree as a clinical mental health counselor, CRAP, at St. Thomas University in Houston, Texas. After completion of my degree, I decided to continue my education and I got a certificate, executive certificate in psychology, which right after that, I decided to even further continue my education in order to better support my clients, and I started my PhD in psychology, social science. That's still in the progress, and hopefully, finger crossed, in about a year, I will be done with it. In terms of certificate and my practice, I mainly practice on CBT, which is cognitive behavioral therapy. On top of that, I'm a certified dialectical behavior therapist, a certified sex-informed counselor, and a certified Gottman relationship therapist level 2, which I'm working on my level 3 certification. My therapy is online. When we talk, this is exactly what you see. Hopefully the same quality, the same audio, and the same basically field of view that you see right now is what you see during our session. And in my practice, it's a little bit different. I am a measure-based provider. So what I do during my sessions is that I integrate Blueprint. First of all, is an app that you can download. And once you download it, you could track yourself. You could track your symptoms, you could track your progress, and every week I send you different assessment depending on what we talk, depending on your journey, depending on what is it that you seek. I send you different assessment. And with those assessments, every week I get a knowledge in terms of actually what is it that is working and what is it that is not working or needs a little bit of change. We work together, both on and off the session. What's more great than that? What's better than that? That we can connect outside of our session. So you have a room to send me messages in terms of how your day was. You have a reflecting place that you could reflect. You could let me know about notes about the next session. So let's say you're doing something comes up and you really want to talk to me about it, but you don't know if you're going to remember or not. Well, rest assured, Blueprint is there to support you. You open the app up, you write it down, and right away I get a message that, oh, client so-and-so wrote this. So I review it, I look at your scores, I look at your assessment, and during the next session, we'll talk about it. Also, if there is something that we discussed during the session, I could send you different assignments, something that you could look at, something that you could reflect on. In terms of my location, currently, I am based in Houston, Texas, and this is where I live. But I am certified and I'm licensed to practice both in Texas, statewide, and in Florida. So if you're looking to improve your mental health, if you're looking to cope with your anxiety, if you're looking to cope with your depression or learn how to work on your past grief, if you're thinking about your relationship is not at the place that you really want it to be and you want to improve, develop, or learn new skills, then join me. Schedule a session. The way that it works is that find a time that works best for you and your needs, schedule that time, and during that time, it's going to be a 15-minute consultation. We'll talk about you. We'll talk about your needs, your desires, your goals for therapy, and I'll tell you a little bit about me because I think it's really important for you to know who I am and how I operate. And after that, we'll set up a time for our intake session. The way that intake session works is that basically we're going to come together. It's going to be about an hour-long session, and during that session, I'll ask you questions. question about you, question about your past, your likes, your dislikes, your relationship. If you had past therapy, I might ask you a little bit about that. What you like, what you didn't like. All of these questions helps me gain a better understanding of you so I can build a treatment plan that is focused on you, that helps you achieve your goal and your goals only. And after that's done, we'll schedule our session. Now, one question that I often get for clients is that how often should we meet? That entirely depends on you. I have clients that they come as needed. They come whenever they need, whenever they're dealing with difficulty, they join. And I have clients that I see multiple times a week. Basically, that is completely up to you. It depends on you and your needs and what you're going through. Usually, I recommend for clients to start once a week or once every other week for the best result at the beginning. But again, like I mentioned before, my goal is not for you to be reliant on therapy. So even though we might start at once a week or twice a week, depending on your need, but the goal is that throughout the time, you be able to be less reliant on therapy and focus on your own well-being. So that might come down. And then we start our session. During our session, when it starts, we start the session by usually going over your week. Okay, tell me what you did, how it was, what was special about it, is there anything that you did that you stand out to you? The first 10-15 minutes of the session, that's the only thing we're gonna focus on. And once that's over, that 15 minutes, I'll ask you usually, okay, is there something that happened this week that you wanna focus on? Or would you like us to continue from your treatment plan or from where we left off the last session? And that could be completely up to you. And then I'll bring out different exercises, I'll bring out different activities, different ways that we can get engaged. And that's the process of therapy. There will be a lot of questions, there will be a lot of different ways that will attack things. And this journey is not a one size fit all. It completely depends on you, your goals, your desires, your things that you want to achieve. So this can change. Maybe for the first couple of sessions, our treatment plan will focus on helping you with your relationship, but as we dive a little deeper, I understand that maybe it's rooted in your past trauma, so we might shift our treatment plan, we might change it, but it is completely tailored to you. Also, during our session, I work with you to cope on your anxiety, I'll work with you to cope with your emotion, with your stresses. I'll give you effective mindfulness tools that you could integrate to your daily routines to make your life just a little bit better. It's not a guarantee with any therapy. If you go to a therapist and you ask them, when will I get better? 99% of the time, they can't tell you that time. And if somebody told you, well, in a week you feel better or in a month you feel better, I would really question the validity of that. Therapy, it's usually something that is really, really personal. It's person to person. And there is not a set time that one could say, okay, but by this date, you will reach this. It usually takes a little bit of a time, but with enough time given, with enough practice, with enough self-care and focusing on yourself, things can turn. And my goal is that within our journey, based on the measures that we have, I'll help you achieve your goal in the shortest time possible. So if you're looking to enhance your relationship, find your best career or your next career, if you're looking to deal with your stress, anxiety, or deal with your school, rest assured that I'm here to support you. With over 4,000 clients that I had during my practice and with a 4.99% high average rating, I'm here to support you and assure you that throughout this process, I will hold your hand and walk with you in your path to give you all the support that you need. So if you're looking for your next therapist in Houston, Texas, or Florida, don't hesitate to reach out for me. I also accept all major insurances and I'm looking forward to meet with you in our next session. I hope that our path crosses and I'll hope to be able to be part of your journey and help you in achieving any goals that you may have. Nothing is impossible. And note, if you even didn't decide to go with me, I will always be here to support you. And know that there is always support out there. It's not wrong to ask questions. And never stop, because the only thing that matters in this world, it's you. And that, my dear friend, is the most precious thing that you could ever lay hands on. You and you only. I wish you all the best and hope to see you in our next session.